Hello, I'm Jennifer Tseng from the University of Chicago, and I'm presenting on the gender gap in surgical education research. In 2006, the New England Journal of Medicine presented an article called The Gender Gap in Authorship of Academic Medical Literature. They examined 6 prominent medical journals: the New England Journal of Medicine, JAMA, the Annals of Internal Medicine, Annals of Surgery, Obstetrics and Gynecology, and the Journal of Pediatrics. And they determined the sex of first and senior authors. They found that the proportion of women increased, but were still in the minority of authorship. Subsequently, the Association for Academic Surgery looked at gender disparities in scholarly productivity in the US for academic surgeons. Over the 2000s, they found that women were still in the minority of surgical faculty, however, were increased in parity comparatively to men in terms of publication history. In follow-up, some of the surgical subspecialties, including plastic surgery, ENT, ophthalmology, and GYN, have looked at this issue. Another article in JAMA Surgery looked at the association of author gender with sex bias in surgical research. A subset of the paper looked at education publications and found that women were in the minority. However, this article reviewed surgical journals including the Annals of Surgery, JAMA Surgery, the American Journal of Surgery, the Journal of Surgical Research, and actually found that women were in the minority in terms of medical and surgical publications regarding education research. This review article actually missed out on several publications that often feature surgical education research. So taking a step back, looking at the gender proportion of surgical education leadership positions, taking a surrogate marker of program directorship, women still are in the minority of program directors nationwide. However, there are oftentimes key faculty members and trainees often involved in surgical education research that are not in the program directorship role. So the question for this study is, what is the gender distribution of authors in surgical education research? Looking at 8 different publications, including the American Journal of Surgery, JAMA Surgery, the Journal of the American College of Surgeons, the Journal of the Graduate Medical Education, Surgery, the Journal of Surgical Education, the Journal of Surgical Research, and MedEd Portal, over a 1-year time period, publications were picked out and first and senior authors reviewed. 326 peer-reviewed surgical education publications were selected out with over 1,900 authors. The gender distribution showed that women were still in the minority of total authorship and senior authorship, however, were closer to parity in first authorship. Looking at each of the journals in depth a bit more, the Journal of Graduate Medical Education and MedEd Portal actually showed that women were in the majority of total authors. However, most of the journals showed that women were still in the minority. In terms of first authorship, the American Journal of Surgery actually showed that women were the dominant authorship in the surgical education literature. The Journal of Graduate Medical Education actually featured 4 women who were also first authors in the 4 publications reviewed. And in senior authorship, women still trail in the minority of authorship. Looking at the combination of first and senior authors, you can see that male first authors and male senior authors still make up the majority of publication ratios. So in conclusion, women are in the minority of authorship in surgical education research publications. However, first authorship in surgical education publications is closer to parity. So some take-home points. This is a preliminary look at gender in surgical education research. This is an encouraging finding for the career advancement of women in surgical education, as promotion is still based oftentimes on scholarly activity, including medical education, surgical education research. Further research is needed for longitudinal comparisons and to elicit qualitative factors related to women pursuing surgical education research. Thank you.